as everybody knows, Father's Day is in the month of June. So this June, we're running some special packages on men's health. Today I'm here with Dr. Jonathan Robles. He's a urologist. Welcome, Dr. Robles.
Thank you, Pamela, and thank you to Sanmare for the invitation.
Sure. Why don't you tell us just a little bit about what a urologist does?
Well, the urologist is the specialist, then does like all the checkups about men's health.
Okay.
And men's health is related to urinary tract system and sexual system.
Okay.
But about women, we also check all the urinary tract system. It's like weird for some like people and women to hear that the urologists also
Sure.
check up women, but they have kidneys, they have urethra, they have bladder, they have a lot
All the
of urinary
organs.
tract infection.
Okay.
So that's mainly what a urologist does.
Okay. And of course, checks the prostate.
Yeah, that's the mainly topic probably about men's health.
Okay.
But also men's health appears since we are 20, 30, 40s. Prostate cancer and prostate checkups start 40s, but also we have a lot of checkups like before 40s.
Okay.
That's why talking about the Father's Month, there is fathers from a lot of ages for sure, at 20s, 30s, 40s.
Sure.
So we have another options also for these fathers that are less than 40. like
Okay.
this.
Yeah, and just out of curiosity, the PSA, how old should the man be when he starts having a yearly PSA?
Well, the checkup of PSA must start at 40s.
Okay.
It depends if you have a risk factor, like if your father or your brother has a background of prostate cancer, you have to start probably 5 years before
Sooner, okay.
or sooner. Also, there is some special patients that has other risk factor, like Afro-Americans has those kind of risk factor, but most of the men has to start 40s. That's the mainly
Okay.
age to start.
That's a good time to start. So for the month of June, I asked you to put together a special priced package. And for the part here at Sanmare, we're going to be doing the lab, the PSA. And then when that'll be done prior to the consult. So when they go to the consult with you, what will you do?
We are gonna talk mainly depending of the age and like talking about like special men's health, but also there is another kind of things that can appear in the consultation. So we are gonna spend some time in that. Also, we are gonna do an ultrasound.
Okay.
Mainly, like everybody knows, urologist is a specialist in men's health and that like what we talk. But the ultrasound, just the prostate and bladder, there is some urologists like I can do it, but the specialist for this is the radiologist, like doctors.
Okay.
Okay.
But you're going to do an ultrasound.
Yeah, we are gonna do an ultrasound. Also, it's good to explain that we need a full bladder first, and we
Okay.
are gonna check how full is the bladder, how the symptoms goes after they get empty or try to get
Okay.
empty the bladder to check
Okay.
the size of the prostate
Okay.
and get related with the symptoms.
Okay. And then also you'll give recommendations to the guys if they need it.
We are gonna call something for this month like decades of life for parent or for Father's Day.
Okay.
So it depends of the decade of life of
Okay.
everybody. We are gonna make recommendations, like even like some ones are gonna be like given by writing, like in
A written
paper,
reports,
written reports, and
Okay.
also we are gonna do some reports after the consultations.
Great. Okay. In order to, all of these studies are going to be done at Sanmare. Dr. Robles has his own consultorio office, but we're going to do these for the month of June only in Clinica Sanmare. And also the PSA will be done here at the lab. If anybody's interested or you want to send your father or your husband or your son for a checkup with this one, you can contact me or you can call Sanmare and we'll get it scheduled. And it looks like we're going to have maybe one day a week that's just strictly for Dr. Jonathan, to come here and see patients.
Yeah,
correct?
of course. We are gonna be here like full day for this program.
Okay. I have one more question because people, a lot of men ask me this,
Okay.
and they asked me to schedule it. Is it still required, or do you still think a rectal exam is needed to check the prostate?
it's not like strictly like or recommended like the only one to check the prostate cancer risk. We use it just in special moments. Like we start with the PSA. It's enough to decide if this patient has to go to another study like a free PSA or like a biopsy or something else. So we don't need to do the rectal examination. We use it mainly when we are thinking about a procedure to plan it, something like that. But like you said, sometimes it's weird to be in the consultation and they just go and I come for my rectal examination,
my yearly rectal
and something else, nothing else.
Nothing else.
We can just pass
we
for
can
it.
skip that
PSA.
part. Okay.
Yeah, it depends.
All right, great. Okay, well, once again, if anybody would like to schedule, has any questions, they can contact me. Everybody has my email or by Sanmare, and we'll get you all scheduled.
Perfect.
Thank you, Dr. Jonathan.
Thank you, Pamela Sanmare.